my experience would be more around not the intricacies of wide field imaging. Can we have the projection, please? Yeah, thank you. We were the first users of Optos. So essentially, thanks to this gentleman, Douglas Anderson, whose child went blind in an eye, and he was emotionally drifted. He's an engineer from Scotland, and so he took upon himself and decided, conceived this wonderful optics where you have a virtual point in front of the pupil, which actually scans the entire retina. So his idea was kind of seeing peripheral lesions and treating them early so that retinal detachments don't happen at the first place. And we bought the first Optos back in 2012. And so generally we throw Optos to everybody. Our technician there, Pratap, is there. He's helping us in conducting the halls. All myopics, all patients undergoing surgery, all myopics every 6 months after surgery, all flashes and floaters. So you get a whole lot of patients to do ultra-wide field imaging. And we do it at 300 rupees. What in dollar terms? $4 maybe. So if you have 500 patients OP, you can get 50 cases a day. 250 days, 300 rupees, that almost recovers half the cost of the machine. So that's the financial part which I have to look to, and then it's happy, seeing and finding lesions and treating them. So the other thing is when you find more lesions and you can show them to your patients like this, you can actually treat them. So there was a 70% increase in prophylactic laser treatments following our Optos acquisition. And I'll break up. We currently have 7 Optos. So starting with the 212 1DX, which still works, but now we've put it off. So that required helium gas, but now with the Daytonas coming in, we acquired 2 machines in 2014, then 3 Daytonas in 2018, and now very recently we bought a California for the angiography part. So essentially, as our 500 patient centers went on increasing, we kept on buying an Optos, allowing the retina specialists not to bend their backs and have back problems. So that was the whole idea. And so we do 45,000 Optos every year, and that recovers us 1.32 crores every year. So I think it's also revenue generating at the same time at such low costs. And now we are enjoying these and finding out these lesions, but I'm nothing close to a retina specialist, so I won't be talking on all this. We have a beautiful panel to talk on all this. Thank you very much. We just wanted to post a concept of how centers which are busy can use Optos for a better advantage. Thank you.
Thank you so much, sir. That was fantastic, and coming from someone who runs these chain of hospital catering to a large population, and I think a lot are even myopes. I think this is a fantastic tool to not only document and to further manage these patients.